Good evening and welcome to Over the Counter, a half-hour show that focuses on health. Tonight we will be talking a little bit about allergies and antihistamines, the medications that we use to treat allergies. Now, what actually are allergies? Now, allergies involve our immune system, and one could say that this immune system goes a little haywire during an allergic reaction. The body feels as if it were attacked by some foreign invaders in the form of pollen, molds, any substance basically, bee sting, venom or any of the like, and the body reacts violently in an attempt to overprotect us from these offending substances. Now, we can inherit allergies from our parents. 50% of hay fever allergies, for instance, run in families. And there are statistics out there. For instance, if both parents have an allergy, a child has a 40 to 60% chance of inheriting that allergy. And if one parent has an allergy, then the chance drops to about 30%. It seems to be a gene on chromosome 6 that is responsible for allergy inheritance. And some new research into allergies is geared at taking a close look into the genetic component of it all. Now, for the purpose of our talk here, I'm going to limit myself to the average run-of-the-mill type of allergy that we come in contact with in our daily lives. I'm not going to be talking much about allergies that become medical emergencies, such as, for instance, an anaphylactic reaction, which is an allergy that runs throughout the whole body, where the patient becomes faint, the blood pressure drops, and so forth, and people have died from allergic reactions. That's a true medical emergency and needs medical attention. Now, we're going to be talking about some allergies that can be a bother, can be a pain, but that are not necessarily putting us into that kind of a danger. We talk about allergies that we can usually handle at home with treatment with over-the-counter medications. Now, I'd like to talk a little bit about the different types, and then mostly I'd like to also concentrate on the medications, as I said before, the antihistamines. Now, let's first talk a little bit about food allergies. Now, this is really a hard nut to crack because it is so difficult to identify what the allergen or the offending substance actually is. Hives, itching kind of all over the body actually, and mostly vomiting, diarrhea, breathing problems, and all sorts of stomach upsets can be symptoms of food allergies. And one can see the difficulty in evaluating this because especially children sometimes are prone to food allergies. But children frequently suffer from upset stomachs of all kinds because they have caught again another cold and another flu somewhere. So this becomes particularly frustrating in sorting out all of these symptoms. However, pediatricians become suspicious of food allergies when a child does not respond to conventional treatment. When we cannot find a cause for that particular upset or why the kid is not thriving and so forth, then very often we look into the problem with food allergies. Foods most commonly implicated in causing allergic reactions are, of course, milk, eggs, wheat, chocolate, nuts, especially peanuts, corn, shellfish, and the likes. Basically, we can be allergic to just about anything when it comes to foods. But food additives, such as dyes in particular, have also been implicated in causing food allergies. So how do we find out what we are actually allergic to? And this is where the frustration comes in. Now, observing reactions and keeping logs on the possible food allergy connection gives us a good history as to the possible connection to a particular food. Finding the cause of a particular food allergy usually goes by process of elimination. You know what it is not. But sometimes an allergy specialist can also shed some light onto the situation by performing different allergy tests. And then, how do we treat it in the end? Mostly, we treat it like we do treat all allergies, basically. We try to, most of all, keep away from the offending substance or the allergen that causes us to be ill. Then, in case of food allergies, we might be enlisting the help of a dietitian that can set up a diet for us, eliminating those substances that we might be allergic to. And the dietitian can also help to track these substances as they lie hidden within the foods that we eat, because remember, foods are a combination of a lot of things, and anybody that has read the label on, for instance, some of the most simple foods can attest to that. And now let's talk about allergic contact dermatitis. And here we are talking about an allergic external skin reaction, such as rashes, hives, itching and so forth, that happen to the outside of our skin by being directly exposed to something that we are allergic to. Poison ivy is a classic example of allergic contact dermatitis. Sometimes we have a difficult time distinguishing exactly between what is an allergic contact dermatitis and what is called an irritant dermatitis. And it will take a doctor or a dermatologist to figure out the difference. An irritant dermatitis is something that is caused by chemical damage to the skin, such as skin damage due to particularly drying substances such as detergents or various acids that can irritate the skin. But now back to our contact allergic dermatitis. So how do we treat this? Again, if we know what we are allergic to, we stay away from it. Sometimes these allergic contact dermatitis things can be quite severe and require even medical attention. A patient might even have to take some steroid anti-inflammatories for a short course in order to get to the bottom of this. But usually home treatment with over-the-counter medications, works fine for these types of allergic reactions. The first step is to wash the skin immediately in order to clean off the additional residue that is stuck to the skin and to avoid spreading this substance that is causing the reaction to the rest of the body just by simply touching ourselves with our fingers. And then for the soothing of the itch, we might be looking at a calamine lotion or some kind of a soothing lotion that also has a little bit of a drying effect, and that helps. For most cases, that helps pretty well. And then we also have the over-the-counter hydrocortisone creams and ointments that also help to bring the inflammation under control and also help with the itching. Now, if that still doesn't help, then we can also add an oral or a pill kind of an antihistamine form. It can take up to 3 weeks for some of these contact allergic rashes and hives to disappear. Now, if you see that you do not improve really on your home treatment, if you have lesions that don't seem to be getting better, or if you have some blisters that burst and do not dry up, but they keep weeping, and you see that there is more redness around the area, then you might be looking at an infected kind of a skin. So this deserves to be checked out by a physician, because you have to make sure that you do not work on a skin infection, because you might be needing some antibiotics, you might be needing a stronger antihistamine, you might even need some other treatment that the doctor will decide upon. So watch yourself when you're doing home treatment with these things. If it doesn't get better, see a physician. And now let's talk for a little minute about insect stings. Now, insect stings or bites are usually associated only with local irritation, the localized swelling, the itching, and so forth. And usually these symptoms resolve within 24 hours. And all we have to do is we have to watch that we don't get too impatient, that we don't scratch too hard and so forth, and let it bother us too much, so that we don't damage the skin and end up later on with maybe a skin infection. Some people have their little local or home treatment where they put salt or meat tenderizer onto the insect bite, and then they say that takes the bite right out of it. However, there are also lotions out there that we can put on the bite, topical lotions or ointments with hydrocortisone in it, or some sprays, and so whatever works for us in order to take the bite out. But usually it is not a medical emergency. Now, we all know people, however, who have at some point or other reacted violently to some bee stings or wasp stings, and that have ended up in the emergency room in a hospital for treatment of a very severe allergic reaction. As a matter of fact, some 30 to 40 people die every year in the United States as a result of allergic reactions, very severe allergic reactions they are, to insect bites and stings and so forth of all kinds. Now, these very severe allergic reactions can occur within 1 hour after the sting, sometimes faster, and They are called the anaphylactic reactions, and this is when the allergic reactions runs through the whole body, and it becomes a medical emergency that is treated with not only antihistamines but also with adrenaline and with anti-inflammatory steroids. People who are severely allergic to insect bites or to bee stings or so forth should be carrying with them one of those prevention kits, or an ANA kit or an EpiPen, and that is a kit that contains the adrenaline so that they have the adrenaline available right as the sting happens or if they go into a severe allergic reaction. Now be careful when you're being prescribed something like this by the doctor and you're going to pick it up at the pharmacy. Make sure that you get adequate instructions as to, first of all, how to inject the adrenaline correctly, what to watch for, and then also that you use the sterile proper technique when you inject this adrenaline. So read the instruction kit and ask questions from your doctor and your pharmacist. Be specific, because it is a technique that you should learn and master. Now, insects in general are attracted by bright colors and bright scents. So do not wear smelly lotions or perfumes when you go walking in the woods. And also we should always wear shoes when we are outside, and that especially goes for children who run around in the summer and they don't wear any shoes whatsoever. Not only can you get glass into your feet or something like that, but it's especially annoying when you find out that you just stepped on a wasp. So sometimes prevention can really do something for us too. Now, what about drug allergies or medication allergies? Remember that we are talking here about true allergies, not just bad side effects such as an upset stomach. If you experience an allergic reaction to a medication that gives you hives, itching, rash, trouble breathing, swelling of any kind, such as swelling of the tongue or swelling in the face and hands and so forth, then immediately write down what the medication was that caused this reaction. Get your prescription vial or the over-the-counter package and write it down exactly. Then call your doctor immediately so that, first of all, this information can be added to your permanent medical file, and also so that you do not stop treatment for whichever reason it might be that you're treated for, that the doctor can either change your medication or can prescribe something else for you. But do not just simply stop taking medicine, especially if it is prescribed by the physician, because you feel that you had an allergy. Report it immediately. Also let your pharmacist know, and let every doctor know that you see, such as your dentist or an eye doctor, that you are allergic to such medication. And it is also a good idea to identify yourself as having an allergy by wearing a little wristband, an allergy alert wristband, or by wearing an allergy alert little necklace around your neck. Knowing exactly what your allergy is could be of great help if you ever have to go to a hospital or to an emergency room where nobody really is familiar with your case. Believe me, we waste a lot of time trying to track down allergy histories. And this causes a lot of confusion, and it causes plenty of delay sometimes in the treatment of a patient. So do yourself a favor. If you suspect that you have a drug allergy, report it immediately and get the specifics down. And now we come to the most widespread and the most popular of all allergies. That's allergic rhinitis. And rhinitis points towards problems with the nose. Now, hay fever is a good example of allergic rhinitis. As a matter of fact, it is a good example of seasonal allergic rhinitis, because this condition seems to be tied to allergens or offending substances that appear with different seasons, such as in spring and up to July, the offending agents seem to be tree and grass pollens. And then we have August and the fall, where we have the weeds. And I just have to say the word ragweed, and that makes many people break out in a rash already, because ragweed gives a lot of people plenty of grief. Then we also have a condition that is called perennial allergic rhinitis. This is an allergy that seems to be lasting all year long. Now, the causes are again kind of hard to pinpoint. It might be dust and molds in the house, it might be animal dander in pillows, it might be pet hair, We just really sometimes don't know. But no matter what the type of allergic rhinitis, no matter what the cause, people who have allergic rhinitis complain of itchy, watery eyes, runny, itchy nose. Frequent sneezing, of course, also aggravates the situation, and in short, we are miserable with these type of disorders. Now, allergic rhinitis situations are usually caused by substances that we inhale. And some people install special filters in their houses, on their air conditioning units and so forth, in order to exclude the pollens and the dusts that seem to be making them miserable. Instinctively, they do the right thing. They try to avoid the offending substance, and that's basically, as I said already, the first way of how we treat and attack an allergy. Now, besides becoming a recluse living in a glass bubble, what can we do? And this brings me to the subject of the antihistamine medication, or some over-the-counter medications that we can use in treating some allergies. The antihistamines are grouped into various chemical classes, and thus they vary widely in their side effects that they are causing and also in their potency. If you do not have any luck with one particular antihistamine, then talk to your doctor or your pharmacist, because they might be able to switch you to a different antihistamine that might be more effective or that might cause less side effects for you. Because the intolerable side effects sometimes people are citing as being the main reason of why they quit taking antihistamines. They cause most commonly, as side effects, various degrees of drowsiness and a feeling of dryness of the mouth or of the throat. As a matter of fact, the side effect of drowsiness makes the antihistamines a very popular additive to some over-the-counter sleeping aids. Antihistamines should not be used in combination with alcohol and with other medications that depress our brain function or the central nervous system. Alcohol, medications that are used to treat anxiety, certain depressions and so forth should not be combined with antihistamines. Also, patients on tranquilizers of any kind should consult with their physician to be sure that the medicine that they are purchasing over the counter is not interfering with the medicine that they are being treated for already by prescription. There is a type of antidepressant out there called the Mayo inhibitors, or the monoamine oxidase inhibitors. And these particular type of antidepressant medications should not be combined with antihistamines. Now, if you are not sure what kind of a medication you are taking, then before you buy any over-the-counter antihistamines, check it out with your doctor, check it out with the pharmacist, so that you make sure that you stay safe. Then we have people who have asthma, emphysema, or chronic bronchitis, any type of lung disease, or chronic obstructive pulmonary disease, such as COPD, it's also called, should stay away from antihistamines, if possible, because the antihistamines, because of their drying effect, have a tendency to thicken up bronchial secretions, and so you don't move the stuff out of your lungs as easily, and it stays down there, and that causes more congestion and sometimes also predisposes people to developing pneumonia faster. Patients with high eye pressure, such as glaucoma, people with heart disease, high blood pressure and thyroid disorders also should check with their physician first before they medicate themselves. If you have ulcers, if you suffer from an enlarged prostate or have any kind of trouble urinating, check with your doctor. Also, most manufacturers warn that antihistamines do cross into breast milk and should not be used by nursing mothers, or they should be used with extreme caution. Before using antihistamines, pregnant women should always check with their physician, because remember, pregnancy and drugs sometimes do not combine very well, and so check with your doctor before you medicate yourself if you're pregnant, for any which reason at all. You should really not take any medicines that are not specifically prescribed for you. Now, antihistamines also sensitize the skin to light, or they make us more sensitive to easier burning or deeper burning when we are exposed to sunlight, for instance. We can also get scaly skin and so forth because we are sensitized to this sunlight. So, especially in summer, when we are taking some of that stuff, and it's, because that's allergy season most of all, don't go and fry on the beach, or don't roast yourself in the tanning booth. You might be causing yourself some damage. Check it out first. Again, these are only some of the warnings and some of the precautions that go along with the use of antihistamines. So if you purchase an over-the-counter product such as an antihistamine, always make sure that you read the instructions and read the fine print and ask those questions again. The pharmacist is there to help you, so is your doctor. And if you are under care of a doctor for any which reason, for any condition, then please check with your doctor before you medicate yourself with over-the-counter medicines. Make sure that you do not have drug interactions and that you do not cause any damage. Now, the side effects of drowsiness and also of that drying effect that I had been talking about before seem to be getting better the longer the people take the medication, because you develop a certain tolerance towards that. But unfortunately, we also sometimes develop a certain tolerance to the medication. So if you feel that all of a sudden your medicine is not working anymore the way it used to work before, if you catch yourself taking more of the medication or taking it more frequently than you actually should, then please check with your doctor or pharmacist. Because you might now be at the point where you have developed this tolerance and where you should be switched over to a different product, or where the doctor also has to evaluate whether the antihistamine is a good treatment for you in the first place. Antihistamines are often found in over-the-counter products together or in combination with decongestants. Now, decongestants help to shrink those swollen nasal membranes so that we can breathe easier, and that is also helping a little bit with the improvement of the runny nose and the watery eyes condition. Decongestants, again, are not for everybody, and we should be reading our label before we use them. First of all, in many people, decongestants can cause some sleep disorders and irritability, especially when they are taken in high doses. Then again, people with diabetes, high blood pressure, heart disease, and thyroid disorders should be particularly careful when taking these medicines, and if you're being treated by a doctor for these conditions, you should check with the doctor first before medicating yourself with over-the-counter stuff. Now let's look a little bit how the various antihistamines and their chemical classes differ when it comes to their side effects. Because remember, that was what we talked about before. They are grouped in different classes, and so they vary as to the side effects, especially drowsiness and drying effects that they cause. Also, I have my list here with antihistamines, and there are some 19 different products listed, and so these are generics alone, and so of course I am not going to go into 19 different substances. I'm only going to be talking about those that we commonly see out there on the shelves. And also remember that I'm not doing any advertising on this show. I'm also not doing any discrediting of any product whatsoever. So what you hear is information that is widely available out there. It is a statement, if you will, of the facts. And now here we go. I'm going to stick to a plus kind of a scale. So if you hear me say 3+ on drowsiness or 3+ on drying effect, that would be high as compared to something that is a 2+ or a 1+. So that gives us an easier way of comparing something, when we stick to these star or plus scales. Now, the first medication that we will be looking at would be the generic name of diphenhydramine. Diphenhydramine is also maybe recognized as the trade name Benadryl. Diphenhydramine is a 3+ in drowsiness and a 3+ in drying side effect. Now, this can be kind of high for daytime use. So diphenhydramine is used often by people at night, especially when they are suffering from intense itching that keeps them awake. Because for daytime use you have to be very careful with this medication because it is very sedating to many people. So be careful with that one. But it is a good medication. It is used a lot in hospitals, especially because we can give it by intravenous use and by intramuscular use, and so diphenhydramine or Benadryl, but it is sedating. In the same class with diphenhydramine, we have clemastine. Now, clemastine is less sedating than diphenhydramine. It is a 2+. Diphenhydramine was a 3+, remember. And anticholinergic side effects, or the drying side effect as we call it, their clemastine is still a 3+. Now, clemastine is available in the newly released product called Tavist or Tavist D. Then we have chlorpheniramine. Chlorpheniramine is available as single agent under the trade name of chlortrimeton. Chlorpheniramine and then brompheniramine, which is with it in the same family under the trade name of dimetane. Those both have a 1+ on the drowsiness effects and a 2+ on the drying effect. So basically these are much less sedating than the other two agents that we just talked about. And then we have the antihistamine triprolidine. Triprolidine is in the same class of antihistamines together with chlorpheniramine and brompheniramine. Triprolidine is also a 1+ on the drowsiness scale and a 2+ on the drying scale. Triprolidine is found as single agent product in Actideal, and in combination there is a product that you might recognize. It is called Actifed, and their triprolidine is in combination with a decongestant. Now let me say a quick word about the two prescription antihistamines that we have. And those are Astamizole by generic, Hismanal by trade name, and Terfenadine by generic, or Saldane by trade name. These two antihistamines are virtually free of any drowsiness and drying effects. However, your doctor will have to watch you for other side effects and some possible drug interactions with these medications. Because remember, in medicine there are no guarantees and there are also no free rides. Every drug has its possible side effects, whether we feel them or whether we don't. And so, before we make a choice on an over-the-counter product when it comes to an antihistamine, we have now learned that they do differ in their action a little bit, and they also do differ as to how many side effects and how severe side effects they cause. And so be careful when you do have to medicate yourself with these, to check with your doctor to make sure that you don't run into any drug interactions and that you do not harm yourself because you are getting into problems with medicines that have already been prescribed for you. Or at least check with the pharmacist. Always ask questions. The generic name with the antihistamines is probably the more important ones, because these products are in so many combinations out there by so many different manufacturers. And this again brings us to the end of our show. I had again so much fun visiting with you, and until next time, this is Monique Hammond saying, stay safe, stay healthy, and good night.